Hi, everybody. I am Dr. Rachel Rubin. I'm a urologist and sexual medicine specialist in the Washington, D.C. area, and we are coming live from the Harvard Continuing Medical Education course in Orlando, Florida, all about testosterone therapy and sexual medicine. And I have with me today a super special treat, the wonderful Dr. Marianne Brandon, who is an amazing sex therapist. Why don't you introduce yourself?
I'm a clinical psychologist and sex therapist. I've been in practice for over 25 years. I'm currently located in Sarasota. I have a Psychology Today blog called The Future of Intimacy, which I have a lot of fun with, so please join me.
And it's really important that when you are taking care of patients that we work in a biopsychosocial model. Yes, we can fix erectile dysfunction as urologists. Yes, we can help with menopausal hormone therapy and symptoms that can help sexual function. But what I find makes my patients actually better and living their best lives is when they have a team. And usually that team is some kind of mental health professional, often a sex therapist or a couples therapist, where they can learn communication. And so what I hope to kind of talk about today for a few minutes is, why is it important that primary care doctors talk to their patients about sex? Because I've never been asked about sex at my primary care doctor's visit.
Well, first of all, sexual intimacy is so critical for most people's experience of life. It correlates with their relationship satisfaction and also with life satisfaction. So this issue is so much bigger than what's happening in the bedroom. And people have struggles probably more than you realize. Sexual dysfunction correlates with emotional issues like depression and anxiety. It correlates with medical problems. It correlates with medication use. So chances are the people that you're working with have some sort of sexual concern, even if it's not to the degree that it would be classified as a sexual dysfunction. But sexual concerns wreak havoc for people. When they feel like they have a sexual problem, they stop touching, they stop relating to their partner. So it becomes a really big deal in their life. So if you can open the door for this kind of conversation for your patients, it could do a great deal of good for them. And it's also good for the practitioner, because if your patient thinks they can talk with you about anything, that's going to establish your relationship with them. And oftentimes practitioners avoid these conversations because they don't have the time to have them, or they feel like they don't have the training. And
you don't have to know all the answers. You just have to show empathy and compassion and say, I hear you. That's the magic in the doctor-patient relationship. We refer all the time when we don't know what to do. And so what happens when I send someone to a sex therapist? Do they watch you have sex, which of course is not true, and everybody thinks that that's true?
Yeah.
Is what happens at sex therapy?
Sex therapy is just like general therapy, but we discuss sexual issues. And because just about anything that's happening in your patient's life can trickle down into the bedroom, we do wind up talking about a lot of stuff that's not directly related to sex, but ultimately impacts their sex life.
And it's true, every medical condition that you treat, diabetes, hypertension, high cholesterol, obesity, depression, anxiety, all of that has very strong correlations to sexual health conditions. And so we treat the underlying condition, but our patients, they don't care about their A1C. They care about the fact that they cannot get aroused. They care about the fact that they don't feel their genitals the same way that they used to, but they don't correlate it with their A1C. And so the education there becomes so, so important.
So I love that point, because people make meaning out of their sexual concerns and dysfunctions. So suddenly their body's not responding like it used to. They either pathologize themselves, something's wrong with me. They pathologize their partner, maybe I'm with the wrong partner. So this meaning becomes very powerful in their mind and then perpetuates the sexual problem.
First and foremost, we're educators. And to say to them, hey, you have pretty out of control diabetes, or hey, you're a smoker, which could affect the health of your genitals. Have you noticed any issues going on there? But if you don't ask, the data shows patients will not bring it up with their doctor. And so how do people find sex therapists?
There are a few fabulous organizations that have on their website ways to find a therapist. So just giving them the website information is a huge intervention. So there are two organizations, ASECT, the American Association of Sex Educators, Counselors, and Therapists, and STAR, the Society for Sex Therapists and Research, and both of them are online where a patient can find their own referral. There are also sexual medicine organizations, the International Society for Sexual Medicine and ISWISH, the International Society for the Study of Women's Sexual Health, where you can also find a referral, a sexual medicine or therapist referral in that way. Today, since COVID, so many therapists have now gone virtual. So really, if you encourage your patient to look within your state, they'll have many more options for a referral. And for psychologists, there's recent legislation that allows psychologists who have signed up for something called PsyPact to practice almost throughout the entire US. So those restrictions that we used to think of in terms of no therapist in my community means no referral, that's really not the case anymore.
All doctors are really sexual medicine doctors, and you will change the whole world by changing your patient's life and just making them have a better quality of life. So thank you so much, and we'll see you soon.
Thank you.